Very good evening to everyone who has joined us today. Am I audible? Can anyone acknowledge if I'm audible? Roshni?
Yep, we can hear you.
Thank you all for joining us today for this insightful webinar on why is losing weight so hard. Quickly moving on to our introduction of our beloved speaker, Dr. Shazia Farhana. So Dr. Shazia Farhana is our consultant physician and diabetologist in Bodycraft. She has an MD with general medicine and a fellowship in infectious diseases. She has extensive experience in managing metabolic disorders, diabetes, and preventive health, and is known for her patient-centric and evidence-based approach to care. And as we all know, weight management is one of the most common challenges people face today. And with new scientific understandings and treatment, it is important to understand what actually happens in our bodies when we try to lose weight. So today she will be sharing some valuable insights on some recent treatments that are available in Bodycraft for losing weight. And quickly to introduce about myself, I'll be the moderator for you all today. I am Dr. Disha. I'm currently the senior manager in medical operations in Bodycraft. And I have over 13 years of experience in medical tech and cosmetology sectors. So without further ado, I'll be handing over the session to Dr. Shazia. Over to you, Dr. Shazia.
Thank you, Dr. Disha. Good evening, everyone. Today, we are going to speak about obesity, which is one of the most important health challenges of the 21st century. We gather here not just to talk about how you are going to lose weight, but to talk about health, stigma, prevention, and evidence-based care. Every year on March 4th, we observe World Obesity Day to raise the awareness about obesity as a chronic disease and to promote the prevention and treatment strategies. Till now, we all know that obesity is like multifactorial. It is not due to lack of the willpower. So today, we will go to discuss about the obesity and how we can take care and how we can prevent and what are the complications and how it is easily evidence-based medicines nowadays to lose weight. So we'll keep it as an interactive session, as a question and answer form. So it will be easy for all of you to communicate also. And we all know that India, nearly 135 million people are living with obesity. And India ranks third in the obesity. And among us, 1 in 4 urban people are having overweight or obese. When coming to the age group, we can see most of the people are in the 30s and we are seeing they are obese and overweight. So now we have to act accordingly. We have to prevent this and how we can improve with the medication. This is the main agenda of our webinar. So as I told you, it will be an interactive session. So I'll be asking a few questions. So it will be better if everyone also take a part in this. So let's ask first thing. Have you ever tried a diet or weight loss plan in the last 2 years? If yes, you can just give a thumbs up. Okay, good. Are you feel like you're doing everything right, but the scale doesn't move? Did it happen with any of us? Yeah. And have you been told like if you eat less and work more, like you can do 1,000, 10,000 steps or move a lot, you can reduce weight? In nearby our friends, colleague, there'll be someone who lost weight easily, but when you couldn't do that. Okay, good. So we'll discuss about these things.
Dr. Shazia, I have a lot of friends who actually really eat well, work out well, and also have very good quality of sleep, but still they're struggling to lose weight. Is it that is it somewhere like they're going wrong by following certain protocols, or is there any science behind this?
Dr. Isha, this is like very good question. We have seen many people, like it will be like our friends, our roommates, or our cousins or siblings will be doing the same thing. Together, we will do exercise like 5 times a week. We will plan a protein meal or balanced food, and we'll sleep a proper sleep cycle, and we'll do all extra activities also together. We'll hit gym. Everything will do same. But sometimes what will happen, we are the one who are not losing weight, and other side people, they are losing weight easily. Yes, there comes like there is a biology and physiology behind this, which will understand. And that is right. Two people, they have identical lifestyle, but they have complete different outcomes. There are like multiple factors that is going to involve. It is like genetics, hormones, our gut microbiomes, our metabolism, everything influence on our body weight. As so, I want you all to understand the biology. In our body, we'll be having hunger hormones. It is like naturally gut hormone which is going to release from our body. So this hunger hormones, it will increase. Because of that, what is going to happen? The metabolism slows down. As the metabolism slows down, we are, even though only fewer calories are getting burnt, because of that, our satiety center will be decreased. It inhibits. Even though we are full, it's like we are hungry and we want to eat more and more. So our cravings, whatever it is, it will be increased. So all those things land up into obesity. Even though diet and exercise, everyone will be doing diet and exercise, but because they are unable to lose weight. So it is not because of the lack of willpower. It is like obesity is multifactorial, where many factors come across.
Okay, so I must say that obesity is actually not actually a medical condition and not really a lack of willpower.
Yes, you're right. So we all know because of obesity, each and every system of our body is getting affected. So we all are very well aware because of obesity, we are experiencing more cardiovascular events. These days, young people are experiencing sudden cardiovascular deaths. Because of obesity, they are having stroke rate is also being increased. In liver, when coming to liver, they land up into fatty liver. Few non-alcoholic fatty liver disease also been addressed, and into cirrhosis liver. All of can hormonal imbalance. Because of hormonal, again, most of women are experiencing PCOS, which can land into an infancy low testosterone. And all of you are aware that because of obesity, a most common joint pains will be increasing, osteoarthritis. These are symptoms experience. All again leads to a mental health, because of which most of the people are landing up into depression, anxiety, and low self-worthiness. And these days we are also recording obesity related cancers also. So obesity not only a chronic disease, it is a disease that causes many diseases also. So we have to treat obesity as soon as possible. So early prevention to every.
Okay. So Dr. Shazia, we understand thoroughly that diet and exercise are equally very, very important to, lose your weight. But is there any other solution that can be used for losing weight effectively?
Yes. I strongly believe that exercise is helpful, but people, they are like able to let the weight. For them,
sorry to
evidence.
interrupt, Dr. Shazia, your voice is slightly breaking.
Okay,
Yeah,
am I audible now?
it's
So you're audible, but slightly it's like breaking.
Right now, is it am I audible?
Yeah. Yes.
Okay. Diet and exercise, it is like full. Few people are there having underlying PCOS and infertility problems, hormonal imbalance, all these things, because of which they are unable to reduce weight. For them, evidence-based medicine, where are medicine, GLP-1, the hormone which is like naturally releases from our gut, and it GLP-1 an hormone released after every meal. After it's a little gut, it is released. Of that
Sorry to interrupt, because you're sharing us some important points, but unfortunately you're breaking a lot. Is it possible to log out and log in?
Okay, because my thing is like good. Am I audible now?
You are.
Yeah.
Now, yes.
Okay, so am I clear now? GLP.
You can just explain this slide once again, because it's an important slide and there was slight disturbance. Yes.
So one is an incretin hormone. Okay, it is released after every meal. It will increase the insulin. As it increases the insulin, there will be a decrease in the glucagon. Because of that, it will slow down the gastric emptying time, and it increases the satiety. It improves our glycemic control, which promotes the weight loss. So this is the GLP-1 action, where I was talking about the biology of obesity, where it is lagging. This medicine will help with that pathway, and it will promote insulin release and helps in reducing our weight. So GLP-1, we are having drugs like semaglutide, liraglutide, duraglutide, and tirzepatide. And the next generation, what we are following is tirzepatide. You can ask me why tirzepatide. With tirzepatide, we are having a dual mechanism. It not only acts on GLP-1 receptor, it also acts on GIP receptor. Because of that, what is going to happen? A fat metabolism amplifies the GLP-1. Because of that, we can see a maximum amount of weight loss, a greater glucose control, and strong metabolism will be happening. So the next generation tirzepatide is like we are suggesting for most of the people.
So what is interesting is how an injection given once a week can, reduce your appetite and aid in rapid weight loss.
This tirzepatide also we are giving based on the BMIs. Okay, it is not for everyone. Not everyone is the ideal candidate for taking tirzepatide. So for whom we are giving tirzepatide? Whose BMI is more than 27.5 with comorbidities. Comorbidities in sense diabetes, hypertension, PCOS, or underlying fatty liver. So for them we are giving, and whose BMI is more than 32.5 without any comorbidities, with uncontrolled diabetes. And as I said, those who have continued their proper exercise, diet, even though they are tired of everything, for them also we can give this tirzepatide. This is like weekly injection, as you said. So now you are asking a question, how it acts. So in tirzepatide, we are having a dosage of 2.5 mg of minimum dose to a maximum of 15 mg. So for the first week, we will inject a 2.5 mg subcutaneously. There, 1-2 weeks, what will happen is it will act on the GLP pathway and the appetite starts to reduce. So later on, there will be gastric emptying time will be reduced. So slowly, 1 week after other week after next week, they'll be seeing a maximum amount and good amount of weight loss. And a week we can see like 600 grams to 800 grams of weight loss. And again, I'm repeating, it depends on person to person. For that, we need to see an entire body work. How is it? as I am telling, like it is a multifactorial. It doesn't depend only on one factor. So we need to do a full body checkup. What is the reason for them? After that only we will decide whether to, on what dose we have to put the tirzepatide.
Right. So there's a wonderful opportunity for the viewers who have participated in the webinar today. Bodycraft is ready to offer free blood camp wherein your blood investigations will be, done from our end at a free of cost as a complimentary for joining us the webinar today. Please make use of it by registering yourself with the link which is there in the Q&A section. The Q&A section is there in the toolbar, which is there below the presentation. So do not forget to click on it and register yourself to get the free blood checkup done. The blood samples will be collected at your home, and the information of the address and your contact will be taken from the registration sheet. Moving forward, Dr. Shazia.
So these are the most common question everyone will be asking after taking injection. Do we have any side effects? So what I tell is, like, with any kind of medication you're using, it can be in a tablet form or whatever regular drugs also you are using, you'll be having a few common side effects like nausea, vomiting. Few people will be having diarrhea, constipation, bloating. These are the common effects they might be experiencing, and few people will be having GERD. But the rare complications are like severe abdominal pain that can lead to pancreatitis and gallbladder stone. So that's why the blood checkup comes in the role. We'll be having an entire body checkup. We'll put you on a loop and we'll monitor closely. So all this weight loss program will be done under constant supervision of an expert physician.
Yes, in a phase where the consumers can get the pen by themselves and inject, it's very, very important for all the viewers to understand that this is not like a regular insulin pen where you can buy it yourself and administer it yourself. You will be thoroughly consulted and well diagnosed by our expert doctor here, and she will be guiding what dosage will be suitable for you and how many sessions are required for you based on the ideal weight loss that is curated for your body. So please keep in mind to always start the treatment only after the expert's consultation and sign-off. Over to you, Dr. Shazia.
So whenever the client who is under treatment will be having a dietitian also, a nutritionist also, so that they will take a proper meal, diet chart, what they have to take during this time, and they closely monitor if they are experiencing any mild to moderate symptoms also. They are like 24/7 approachable to give the medication, and they'll put you in the 360 degrees loop also, so that it will be helpful for them. This treatment should be under supervision of a physician. That is for sure. Okay.
Thank you so much for reiterating that, Dr. Shazia. There is one, doubt which is lingering in my mind that, after looking at a lot of, patients who are undergoing Ozempic treatment earlier, there is this thing called Ozempic phase, which the patient would land after using Mounjaro or Ozempic. They will drastically lose weight and they may have a sagging effect of the skin. So is there any additional therapy that you can suggest along with Mounjaro or with
obviously. We have many clients and patients who are like overweight. Few people will be more than 100 kgs or 120 kgs. Obviously, when we are putting them in this treatment, and this is not like 1 month session or 2 month session for them, it will be like a proper 24-month session for few of them. For few, it depends on the weight, how much they have gained. So obviously, you can just imagine a person with 120 kgs, suddenly he's dropping to 90 kgs. Obviously, the abdominal fat will be sagging, his double chin will be sagging, skin will be wrinkled. So that is where the body craft comes here. This is like 360 degrees approach we are giving. We'll give skin tightening for them so that it will be helpful to tone the body. Few people might be experiencing hair fall. This is like common symptom for everyone. Hair fall, for that also hair rejuvenation, GFCs, there are like many treatment. Injectables are there. Again, fat IV burner drips, glow treatment, all this like helpful. It depends on the person, how is it. Based on the appearance, we will plan accordingly what are the additional treatment they might be needed. So this is a 360 degrees approach what we are giving over here.
Okay, thank you so much. Yeah.
So I think by this time, everyone has come to know like obesity is like treatable. It is not a choice. Obesity is treatable. Early intervention can prevent the complications. Yes, let us move from blame to science and from stigma to support. And we have proven that GLP-1 therapy is proven and it is like evidence-based medicine. Thank you.
Thank you so much, Dr. Sajia, to put a lot of science in a small nutshell for all of us. I know it's a very, very deep topic. You've really worked very smartly in making all of us understand in a very short session. So thank you for the insightful and informative session. So today, all of us have learned that weight loss is not just about willpower, but involves complex hormonal and metabolic processes, where GLP-1 slash Monjaro plays an important role. So understanding the science behind it helps us approach the weight management in a more informed and healthier way. So thank you so much, all of you, for patiently listening to us today. Please feel free to drop in all your queries in the Q&A section in the toolbar, which is appearing below the presentation. We would love to hear your queries, and Dr. Shazia will be happy to address all your concerns today. So we request all of you, the session is open, and please drop your questions, concerns.
Dr. Disha, I think Mr. Mohit had a question. I think you can check the chat.
Yeah. Let me check. Yes. So good evening, Mr. Mohit. We have a question from Mohit. He has asked about the presentation, though not really on the
No, just
So
scroll.
so again he has asked, my BMI is 30.7. Is GLP-1 right treatment for me?
If at all he has undergone a proper diet and physical activity, even though he is unable to reduce weight, and again I need all the blood reports to see whether everything is good or not, then only I can suggest like GLP is for him or not.
Okay, so on a broader level, Mr. Mohit, you are falling under the category where GLP can be an option, but again, thorough understanding of your blood investigation and your medical history and your current condition of your health will be required, post which Dr. Sazia will be able to tell whether you're the right candidate for GLP. I request you to please utilize the registration link for getting a free blood investigation. And another question from one second. Yeah. Question from Ms. Priksha. What is the difference between Monjaro and Ozempic?
Yeah, I told in my webinar only, it's like Monjaro, it acts on a dual pathway, like GLP-1 receptor and also GIP pathway, which help in the fat metabolism. Whereas Ozempic is only GLP-1 receptor. So it follows a one pathway. So that is the main difference, what we are seeing in Monjaro and Ozempic.
Okay. And there is one other question from Mr. Kiran. How expensive are the treatment plans? So, Mr. Kiran, you can register yourself using the link which is there in the Q&A section. We will reach out to you to explain the various packages available with us. The packages is mainly determined based on the number of sessions that may be required for your ideal goal of weight loss. So our team will be explaining you regarding the sessions and the commercials. Thank you so much. And moving ahead, we have another question from Prerna. Can weight regain happen after treatment?
A good question. So as I keep on telling you, this weight reduction, what we are going to do for the first, it's like inspiration and motivational thing for all the clients. First, they can reduce a 10 kgs, and then what will happen? They will continue this systematic and disciplined lifestyle. So it will be helpful for them to maintain the dose and maintain the weight. And after the treatment also, we are putting a maintenance dose for the extensive of 8 weeks to 10 weeks, depending on the weight, how much they have reduced and what is the desired weight. Based on that, we will put a maintenance dose. So that will help you to not regain the weight that much. Even though I just doubt myself, if you're losing that much of weight, again, treatment has been finished and again I want to eat all those things, that is not a good criteria also. So we have to follow a disciplined lifestyle and be in a healthy way. So that is the most important thing. So mostly we will help you out to maintain the dose and maintain the weight also.
So basically, Dr. Shazia, you're trying to say that during the course of losing weight while using Mounjaro or Wegovy, we will have to cultivate the actual lifestyle which can give us a long-term
results.
Result for maintaining a good metabolism. That is what it is. Next question again from Mr. Mohit. Does weight loss also result in muscle loss?
So for this, first we need to understand the body BCA, body composition analysis. As I tell, like this is like first fat metabolism will be going on. So if at all in the body, more fat is there, obviously that is only going to reduce. Even though if your muscle is like a little bit and your fat is more, so first fat loss will be there. Muscle loss, it won't be there. Okay.
Okay. And again,
for that we need a BCA report. It's like very important.
Yes. So the initial consultation with one of our doctors in Bodycraft, y'all can walk into your nearest Bodycraft clinic and get an initial consultation with our doctors in the outlet. They'll be able to give you the BCA report, body composition analysis report, which can be broadly used to see how the treatment will be effective for you. So moving on to the next question from Miss Hansa George is also asking about the cost. So Miss Hansa, again, reiterating, please get yourself registered in the blood camp sheet, which is there in the Q&A box. We will reach out to you using your details which you have posted there. My team will be letting you know the available sessions and the costing. Then comes another question from Miss Malati. I took the injection, but first dose did not work for me. There was no weight loss. I noticed this twice.
So again, for this, we need to go through the blood reports, her scan report, whether she's having underlying PCOS or thyroid. And we need to see, like a minimal dose is not at all working for her, then we will increase the dose. From 2.5, we will increase to 5 mg to see how much the injection is needed for her to get a proper weight loss.
Okay. I hope, Malati, you got that. Reach out to us. We will be guiding you further. And another question from Miss Neha. Miss Neha asks, what should be done if weight remains same during 5 mg dose?
So you are resistant to the 5 mg dose. So we will increase to 7.5 mg.
Again, with the necessary blood
Yes.
investigations, yes. And then comes Miss Malati again. Do we need to take this injection in correct interval, or if we take after second dose after 10 days, that is to increase from 1 week to 10 days, will it work?
No, it's not like that. It's like every week, a proper time and scheduled injection only, it is better. We can see a very good result. If at all in any emergency or unknowing accidents happen and unable to take, we can give a gap of like 48 hours, not more than that. If at all it is more than that, what we'll do is like we will skip the dose of that week, and from next week, the same scheduled thing we can continue.
Okay, so consistency is the key, viewer. Then comes another question from one of our doctors who would also want to get a clarity. I have been diagnosed with PCOS and find it very difficult to lose weight despite following a proper diet and regular physical exercise. In such situations, is it medically advisable to consider Monjaro for weight management, as my BMI is 26? And could it have any adverse effect on hormonal imbalance associated with PCOS?
Okay, this is a very fantastic and very good question. So many of the females have been diagnosed with PCOS. Again, here it comes age. What is the age group? First, we need to see whether they are about to plan a pregnancy. That is also like very much important. If they are like planning pregnancy, because this is not has been evidence is not there for pregnancy and those who are lactating. So we are not prescribing this Monjaro or GLP-1 to these clients who are pregnant or who are lactating and breastfeeding mothers. So with PCOS, we are seeing age, and we have to check their hormonal imbalance. If at all everything seems fine and unable to reduce weight, even though with exercise and diet, for them, yes, they are the ideal candidate. We can give them Monjaro.
Okay, so I hope our doctor got it. And also, if any doctors who have participated in the meeting, if you all had any patients that you had encountered for Monjaro, do put in your testimonials with us in the chat box. Next question is, what about the news about issues with pancreas? Are the side effects dangerous if they, come on?
With pancreatitis, why we get pancreatitis? This is most common in alcoholics and those who are having gallbladder stones. For them, they are like prone to have pancreatitis. So if the person is undergoing this weight loss management and who are like addicted to alcohol, we first tell them when they are in this program, they are not allowed and it is compulsory abstinence of alcohol. So if few people are continuing and taking this, for them, they are landing up into pancreatitis. For that reason only, we are like every month, we are putting on a loop, we'll test, every time we'll be keep on testing the enzymes. If at all they are elevated, if they are prone for pancreatitis, so at that time we can stop. Okay, so underlying conditions and lifestyle is also very important for pancreatitis. It is not like taking injection, we are getting pancreatitis. That is not in that way. Underlying what are their habits, their addictions, that also matters. Okay, yeah.
And the next question is from Miss Anupa. I have BMI of 32.1 My weight is 77.25 kg. I have insulin resistance. Do I need to go for GLP or diet and exercise will help?
Have you tried diet and exercise? Have you reduced weight? For how long have you tried this diet and exercise? Even though with that, it is unable to reduce the weight and your BMI is more than 32, then we will plan whether you are a candidate or not.
Okay. That's the answer. And the next question is from Miss Shalini. Heard from many people after Munjaru, there is huge hair fall issue. Is this a side effect? How can we stop this along with the treatment? If not, then is there any supplement that can be taken?
See, with any kind of weight loss, not only with Monjaro, if you're doing a proper diet and physical activity, you will be losing some supplements. Because of that also, we'll be experiencing hair fall or hair loss. And not only with diet and exercise, this time because of the environmental factors, and there are like multiple factors for hair loss also. It is not only because of this medication, one is going to lose hair. Again, hair fall is an like vast term, and they are underlying many causes are there for hair fall thing. Yes, you can take supplements along with this treatment. It's not a problem. You can take. It's not like we shouldn't take any kind of medications. We can take treatments also for hair fall along with this weight loss program.
Okay. And again, another question from Ms. Anupa. Are these treatments targeting visceral fat or subcutaneous fat?
It's not like targeting only one fat. It is like overall fat metabolism is going to happen. So it is good, like lipid metabolism will be going on in our, so it helps lose your fat. Not only like subcutaneous or visceral, it is like overall fat body is helpful in losing this.
There's one more question from one of our doctors. Is it okay to consider Monjaro while I'm already on medication for PCOS? Is there a specific timeline I should wait for consultation?
See, for PCOS, again, we need to take a detailed medical history, what hormones they are using, what hormonal medications they are undertaking. Because of this hormone medication also, they'll be having increase in weight. So if at all they are planning their pregnancy and they have put them on hormonal thing, at that time we are not considering them to go for this weight loss program. So that is the main agenda. If they are not at all planning, then what we will do is like we will stop the medications what they are, because for PCOS oral form, I think stop and we can put injection form. So anyways, with reducing of weight, hormonal imbalance will be corrected, and the regular cycles, they can attain regular cycles, and that will also be helpful for them. Okay. Yeah.
So there's one more question from Miss Tanya. What is the best clinical approach when patients hit a weight loss plateau while using Manjaro?
Yeah. So that's what I told you, like maintenance dose. We will put them on a maintenance dose for a further 6 to 8 weeks. And later on, we will help them in maintaining weight in that period and continue the same lifestyle, same disciplined physical activity, all this matters, and they will helpful in maintaining the weight. And we'll put them on the oral tablets also later on to maintain the weight also. It is not like a short-term course. Obesity, it is a chronic disease, so it will take a long period for them to attain a good and desired weight. A lot of patience is also required while being in this weight loss program. It's not like whenever you're taking this injection for that week and at a time you have to lose weight. Sometimes you can see inch loss will be going to happen rather than weight loss. So you can measure your body and see how is it going to happen. Every time you have to keep motivated yourself to reduce a weight and put yourself in a healthy lifestyle.
Very, very clearly explained, Dr. Shadya. So I think we can wrap up with a question answer section. No more questions I can see. If anybody has any concerns and you all want to reach out to us directly, we have shared Dr. Shazia's mail ID in the Q&A. Shazia, Shazia @ bodycraft.co.in.